So it's my pleasure and honor to introduce Dr. Rollin McCraty, the Director of Research at the HeartMath Institute, a psychophysiologist and a leading expert in the matter of the heart. So today, Dr. McCraty will discuss the latest research on heart rate variability and cover practical applications of heart coherence technique in clinical setting, showcasing their potential to complement traditional therapies and improve patient outcome. So, guided by a very powerful intuition coming from the heart, Dr. McCraty chose this special day today, his wedding anniversary, to present at our conference. So, we're honored to have him with us today. Please join me in welcoming Dr. McCraty.
All right, thank you, Sarah. So I'll just jump in. You can see my slides on your screen there, I assume.
Yes,
Okay. All right, so let me just go ahead and jump in and let's see. All right, so I just wanted to start with what I hope is obvious to many of you, but often not. And that is that emotions really run the show in terms of our physiology, what's going on in the nervous system, hormonal system, and so on. And that's actually really easy to demonstrate here in the lab. I mean, we can have you wired up to, EEG and ECG and skin conductance and so on, and looking at hormonal and immune markers and so on, and have, a participant, do serial subtractions or whatever, thinking different thoughts and so on. And yes, we can certainly measure changes, but not much when you compare that to when you trigger an emotion. You get embarrassed because you can't do subtractions in your head well, or you get frustrated or impatient, or on the other hand, you feel appreciation or gratitude or feelings of love and compassion, these type of emotions. Big changes happen quick in your blood pressure and the neural activity in the nervous system and so on. So it's, and I suspect that most of you here at this conference have an abundance of patients who are stressed out, overwhelmed, exhausted, these types of things. And stress is always an emotion. It used to be, well, and still to a large degree, that the number one reported stressor was time pressure, which is defined as the feeling that you never have enough time. These days, that's number one is being stressor is being replaced in a lot of surveys in the Western world of having to deal with difficult people. But the point here is that when we talk about stress, it's really always an emotion. It's our internal response to what's happening in the external world. So therefore, it's really learning to become more aware of and how to manage, not suppress, or transform emotions into a more of a positive vibration, I'll dare say, and I'll explain what I mean by that later here today. That's really the key to improving patient outcomes. And, in my field, psychophysiology, it's becoming quite clear in today's world that it's really the key to optimal function, to being able to be healthy, perform well, really boils down to how in sync we are. And in fact, it's the brain's ability to synchronize its own electrical activity that has to be able to do that to even be conscious and awake. So it's really the degree of synchronization, not just within the brain, but within the system as a whole. That's really the key to optimal health, but certainly our ability to focus, to think well, perform, self-regulate. These are all functions that are ultimately based on synchronization. And this is where the heart plays a major role. And the second statement on this slide, the heart sends far more information to the brain than the other way around. This is not new information. This has been known since the late 1800s, in fact. And if we take the vagus nerves, for example, the two longest nerves in the body, which come down through the front of the body, of course, those are quite large nerves. There are thousands of neural fibers in each of the two vagus nerves. And most estimate that 90% of the neural fibers in the vagus nerve are afferent or ascending, sending information from the body, thoracic cavity to the brain. And only 10% are brain down. And the vast majority of those afferent or ascending nerves are literally coming from the heart and cardiovascular system. Now, the bottom statement on this slide I'm going to use the word patterns here, but the neural activity and the patterns of activity that is being sent from the heart to the brain, and I'll show this I think I have a slide on this coming later, but they go to every major brain center and have profound effects on our perception, our ability to self-regulate, and even our emotional experience. I mean, after all, why do we say "I love you with all of my heart" when we fall in love? Probably wouldn't go over very well if we said "I love you with all of my brain," because we know intuitively there's something more about the heart that has to do with these higher emotions. Now, what wasn't known when a lot of this research was showing how the heart affects brain function, which dates easily back to the 70s, wasn't really well known or known much at all that the heart actually has its own intrinsic nervous system called the intrinsic cardiac nervous system, which was actually mapped out by a very close friend of mine, a Canadian researcher, Dr. Drew Armour. And he's actually the guy who coined the term heart brain for the brain and the heart, because the neural structures in the heart, these neurons have been proven largely in his lab to have short-term memory, long-term memory, excuse me, neuroplasticity, and so on. And the way that they're all interconnected and distributed throughout the heart, we can literally say as its own independent functional brain and the heart. So that helped explain a lot of the findings that were kind of a mystery. You know, in fact, a lot of the papers of that era were using language in them like the heart acts like it has a mind of its own. You know, just really a fascinating history of that, which I don't have time to go into today. But here's a kind of a simplified block diagram of how the heart and brain communicate in terms of neural activity, nervous system activity. But in reality, the heart's communicating with the brain and body in 4 different ways, not just the nervous system. So we've got the efferent and afferent, or descending and ascending pathways through the vagus nerve, which I mentioned, but it's also the spinal column and the sympathetic chains also have both efferent and afferent pathways, or ascending and descending pathways. And just one thing I wanted to point out here on the right side where we've got the heart, we see the descending or efferent pathways connecting into the intrinsic cardiac nervous system, both from the sympathetic and parasympathetic branches of the nervous system. And this is something where most of the medical textbooks and teaching still haven't caught up. You know, a lot of times if you look in an anatomy book or so on, you'll see these neural connections coming down from the brain, going to the SA node and the cardiac tissues and so on. It's completely wrong. Absolutely all of these neural connections efferent pathways coming down to the heart, all interconnect into the heart's intrinsic cardiac nervous system. None of them go directly to the cardiac tissues and SA node. And then you've got about 50,000 what are called sensory neurons within the heart that are sensing information. They're sensory neurons, and you have 2 different types. What are now called mechanosensitive neurons, used to be called baroreceptors, are sensing things like rhythm, rate, and pressure. Then you have about 80% of those neurons are chemoreceptive neurons. So they're receiving the biochemical information in the blood, basically. And that's being processed within the intrinsic cardiac nervous system, integrated with the efferent pathways, and then sent upstairs to the brain. So it's a lot more complex than previously understood. Okay, and then once these signals get up to the brain through both the sympathetic and parasympathetic afferent or ascending pathways, this graph, you can see they go so anyway, the point here is that once these afferent cardiovascular signals come into the NTS, there's direct neural pathways to most of the major brain centers. And just 2 I'll point out here is one is the thalamus and the amygdala. So you see these direct very strong direct neural connections that will be relevant for some of what I'll be talking about today. Okay, so what gives us the ability to kind of eavesdrop or look at the communication between the heart and the brain, and really the activity within the autonomic nervous system, is heart rate variability, which I'm sure most of you are aware of. And so I'm not going to go into a long discussion on HRV today, because because there's probably so much of this over the years. But just as a general high-level statement, the amount of heart rate variability we have more of it when we're young, talking about the how much now of this natural intrinsic heart rate, beat-to-beat variability. And we want a healthy amount of variability. We have more of it when we're young, and it basically more or less decreases across the age span in a more or less a linear relationship to age. So if the amount of variability, that age-related variability that we have, and you always have to take age into consideration from a risk assessment perspective, is lower than it should be, that's really reflecting, kind of a very deep level of system depletion. And we've done many thousands of 24-hour HRV assessments we work with a lot of clinics all around the world doing these autonomic assessments. And I can pretty confidently say that the number one reason for low HRV, the amount of HRV a person has, is chronic stress. It's long-term stress. And you don't have low HRV because you had a bad day or a bad week or even a bad month. It's a long process it's usually long-term stress, especially emotional stress. Number two is pathology, usually something to do with high inflammation. So we see, in fact, you can see low HRV start to drop faster than the normal age-related decline, in some cases several years before the onset of any symptoms, like in cancer, diabetes, things like this. And when you have low HRV, it's really reflecting that somewhere in the neural axis in the autonomic system that we've lost adequate functional control in the regulatory systems. So just I'm sure a review for many of you. What we all know what heart rate is, right? How many times does the heart beat in a minute? But in a healthy person, a well-functioning person, our heart rate changes with each and every heartbeat. So heart rate variability is a little harder to measure because you have to accurately measure the time interval between each pair of consecutive heartbeats, like we're showing here. On the bottom of the slide is the electrocardiogram. And then so you can see on the left side that we're measuring in milliseconds, the time between each heartbeat, and they're always changing. And then the blue line is where we plot that beat-to-beat change, which is technically called instantaneous heart rate. So you plot that, and the blue line becomes the heart rhythm. So if without heart rate variability, there is no heart rhythm. So if the time between each pair of heartbeats was the same, the blue line would be a flat line. It would be actually no up and down variability, which is always going on in the heart rhythm. So we see on the left, the time intervals are getting a little bit shorter. So we see an increase in the heart rhythm. And then over on the right, the time intervals are getting longer between each pair of beats. So heart rate is slowing over there. So that's really what we look at a bunch of these intervals over time, and so it really becomes heart rhythm analysis is really a more accurate way of talking about it. This is what HRV looks like over longer time periods. So each of these squiggly lines is an hour long, and then the little vertical lines is 5 minutes. And so all of these changes, especially when you spread them out so you can see more of the dynamics, they all reflect the activity that's going on in our autonomic nervous system. And so we'll be talking more about coherence in a moment. I'll explain what that is. And restful sleep on the bottom and REM sleep, you can see are all reflected. In fact, in sleep, you can tell whether somebody's having a nice dream or a nightmare, things like that. It's clearly reflected in the pattern of the HRV. So long term, we're looking at how much typically in the case of risk assessment, or really trying to understand the functional status of like I said earlier, the complete neural axis, the heart, autonomic nervous system, and brain and higher brain systems are all reflected in HRV. But now when we look at a little over shorter time scales, we're really more focused on the pattern of the HRV, which is independent of how much HRV a person has. And these things reflect current state, and they're affected by a lot of things. Cognitive workload, for example, energy expenditures, emotional state, and so on. And when we have what are called coherent rhythms, which I'll show you next, we now know 500 studies later, independent studies, that coherence is really an optimal state. That's reflecting nervous system stability. and an enhanced ability to self-regulate. It's pretty early for me here in California. So anyway, this slide you see here, this is actually we've got gazillions of examples like this, but I use this one because it's really from an original study, the first study showing that emotions are reflected in the rhythm of the heart most accurately, that we published in the American Journal of Cardiology back in the early 90s. So what you see on the left, this is HRV, or the heart rhythm. This is the typical looking heart rhythm when somebody is feeling things like impatience or anxiety, worry, frustration. Anger is way worse. It gets much more chaotic looking. Now, what this rhythm is reflecting is a desynchronization in the activity in our higher brain systems and within the autonomic system. And there was a term coined to describe the effects that this type of a heart rhythm has, the afferent information going to the brain, actually dating back to the 1970s. And that's called cortical inhibition. In other words, the cortex, the cortical part of our brain, is inhibited, doesn't function well. Same person is shown here on the right when we, in this case, this is a lab-based study, asked them to re-experience and really feel appreciation. But we now know that any emotion like love, compassion, kindness, just even being inner still, breathing a feeling of inner stillness will take you into this, what we call coherent rhythm now. And that was also associated back to the original terms. It's called cortical facilitation. In other words, cortical function is enhanced. So most people are going back and forth between these two states throughout the day. I'll give you an example here. You walk out the door in the morning, it's just one of those gorgeous days. You just feel, oh God, what a beautiful day. You're really feeling appreciation or that kind of sense of awe. We're likely in a coherent state, just naturally, even though you may not think that. Now, just an important thing to point out here is these patterns in the heart rhythm are more or less independent of heart rate. In other words, you can be in an incoherent or a coherent state at almost any heart rate. So this makes it very different than relaxation, right? Or what the states you go into in most meditation approaches and things. In other words, you can be at home, after a long day, low heart rate, kind of physiologically, we would say relaxed, maybe talking to your spouse about the day you just had and rehashing the things that went on and be in a completely incoherent state. Or you can be at a higher heart rate and be in a coherent state, right? Which is really important, which is why a lot of athletes and law enforcement and so on are really into coherence training. Okay, so when you're in that coherent state, we're really getting in sync. I'll talk a little bit more about this later, but we have an actual resonant frequency that we um, shift into. So here we're looking at breathing rhythm, respiration on top, the heart rhythm on the center, and blood pressure rhythms, which also vary beat to beat on the bottom. And you see in the kind of the center of the graph, the dotted line, this is where the person used one of the many coherence techniques. And you can see how fast you can actually shift into that coherent state with practice. And the point is that you can do this anytime, anywhere. And the next slide is showing you the frequencies of these different rhythms over on the normal state or before. You can see that they're all different frequencies. They're kind of out of sync. Whereas during the coherent state, they literally frequency entrain. So this is one of many examples of getting more in sync, which is this more optimal and energy efficient state. Okay, so it took a lot of labs around the world, actually quite a few years, to really sort out all the mechanisms of how all this works in terms of how the afferent or ascending neural pathways from the heart are affecting cognitive function and brain function. And at the end of the day, it's pretty simple. As I started this presentation today, I was talking about how the brain has to be able to synchronize its own electrical activity. So we have these ascending or afferent neural connections coming up through the sympathetic and parasympathetic afferent pathways to the brain, the DMTS. But from there is a direct neural pathway to the thalamus. Now, thalamus has a lot of roles, of course, the very core of our brain, and we have one of those. And one of its jobs is to synchronize globally the neural activity in the brain. So when we're in this incoherent rhythm, that path through that pathway, that incoherent neural activity basically interferes with or inhibits its ability to synchronize neural activity globally, hence the term cortical inhibition. So this could be reflected in, or is reflected in things like reaction times, coordination tests, visual field tests, and many studies done around the world, including here in our own lab. But the part of the brain that is affected, I would say the most, is the frontal and prefrontal cortex. And one of my mentors, a guy named Dr. Carl Pribram, pretty famous guy, what I learned from him was that really the capacity the frontal areas of the brain give us is foresight, right? Which is the ability to understand how our actions and emotions and behaviors in the moment are going to affect the future. So planning, goal setting, abstract thinking, but especially a discrimination of appropriate behavior. Not a good idea to, yell at the boss if you want to keep your job. It's really self-regulation. Is really that. It comes from this from foresight. So those neural systems and structures that are involved in those capacities to perform well have to be well synchronized. So when we're in this desynchronized state, those are taken offline. This is why I can say this two ways. It's why when we get angry, we do stupid things. Or I can say it more uh, politely, like why a very intelligent person can make bad choices when they're emotionally upset. Now, on the other hand, when we're in a coherent state, as we call it, that rhythm is going up to the thalamus. It actually facilitates and enhances global neural synchronization. So that's why we see measurably, significantly increased things like sensory motor integration, memory, making better choices and decisions, and really anything that it really elevates any function that we have because kind of just makes common sense if we're more in sync that we're going to perform better. Now, the it's not just neural synchronization within the brain, but it's also between the heart and brain. Now, I won't go into just because of time and detail here, but this is based on what are called heartbeat evoked potentials. We can actually measure how synchronized the neural activity in the brain is to the cardiac cycle, to the heartbeat. And for most people, just wherever you are now, about 14 to 15% of all of your brain rhythms are synchronized to the heart. Now, when we're in a coherent state, that's significantly increased. So what you're seeing on the slide here now is data from about 30 people. Over on the left is the baseline state. And the more red, the more synchronized, in this case, it's the alpha rhythm, is. So in the coherent state, we see a lot more red. So in other words, there's measurably increased synchronization in the activity between the heart and brain. So a lot's going on automatically when we're in that coherent state in terms of increased synchronization between the heart and brain itself. So once we really understood the physiology of this here at HeartMath, we developed a number of tools and techniques. We call them self-regulation techniques that can pretty quickly be taught to anyone to maybe be able to make that shift into the coherent state. The hardest part is people remembering to do it because when we get stressed and triggered, we kind of forget whatever we learned. It's out the window. And one of the tools that we have in our toolbox to facilitate people learning these self-regulation skills or how to make that shift is what's called heart rhythm coherence biofeedback and training. And in fact, the first device ever that started this whole field actually used to be called the freeze framer, now called the M-Wave Pro some years ago. And that was introduced in the late 90s. And the M-Wave Pro is basically a professional HRB coherence biofeedback training system that has a lot of games and cool things that allow, usually in either educational settings or healthcare settings, to train patients how to these techniques and how to make that shift into coherence. And then later, the first actually mobile app to ever measure HRV and HRV coherence was called the Inner Balance. And that's hundreds of thousands of those around the world and primarily used by healthcare professionals. Then we introduced what's called the Global Coherence app, and I won't have time to go into the Global Coherence project, but this is a device, a mobile device that allows and that's actually a free app that allows people to not only measure their own heart rhythm and see in real time how coherent they are and practice skills to increase it, but also measures a group or a collective community's level of coherence. So it's often used in team training or group training, these types of things, or larger events around the world to measure the collective level of heart coherence. Or we often say how much love, how much compassion is being added into the local or global field environment. And then the latest app is simply called the HeartMath app. And this one is one that integrates the tools, techniques, and a lot of the how-to, the training for consumers and especially patients. It's really a lot of it's focused on the kind of things that healthcare professionals care about because a lot of it you don't have time to be doing in clinic training. So it's a way of introducing patients to the concepts and what coherence is and why they should do it, but something they can do on their own at home and do home practice. So that's the latest app, and it has a free trial. There's also both the Global Coherence app and the HeartMath app. This is an important point. Allow you to use the camera on your phone as the sensor for your pulse. But if you really get into it and are really using it a lot, it's better to have one of the professional sensors, which aren't that expensive. Um, so that's makes it a great home training system. Put it that way. Now I'll show you this paper in a minute. Recently looked at 1.8 million sessions of people using these apps and their level of coherence, looking at what we call coherence frequency, the rhythms that they synchronize around. And in other words, we have a literal resonant frequency, and this is where it has to do with the neural activity, primarily between the heart, brain, and lungs. And it's the internal feedback loops that create this resonant or coherent frequency. And we can see here that this is a study of people all around the world using these apps that our primary resonant frequency is around 0.1 hertz, which is a 10-second rhythm. If you're breathing 5 seconds in, 5 seconds out. But there's a lot of lower frequencies that are associated with these higher coherence levels. Now that has a lot of implications, which I don't have time to get in here today, but it's kind of important to know that it's in the way we talk about our techniques is to have people breathe, focus their attention in the area of the heart, breathe so they're breathing through the heart, but find the rhythm slower and deeper. And it's going to be around a 5-second rhythm on the in breath and 5 seconds on the out breath, but find the rhythm that's comfortable because we find that people will naturally find their own resonant frequency this way. Okay, now I mentioned there's over 500 independent studies now. And so these are not all, but I think a fairly good list of the proven clinical benefits of HRV coherence biofeedback training combined usually with some of the self-regulation techniques. So reduced stress and anxiety, many studies on this. Improved emotional regulation and resilience, enhanced cognitive function and performance, ability to focus. Kind of a really important one a lot of people are understanding these days. Increased vaguely mediated HRV. In other words, we can decrease that natural aging decline. Boost cardiovascular health, lowers blood pressure, many studies. In fact, I dare use the word almost magical in terms of blood pressure reduction, this coherence training. Strengthens the body's stress response systems. We've studies showing reduced over longer time periods, reduced cortisol, increased DHEA, and so on. Improved sleep quality. Now, there's some studies that have in the last few years most of these have been done at USC, the University of Southern California, in a really well-funded group, but using MRI studies showing significantly increased cortical volume in basically the prefrontal cortex, and also increased functional connectivity, measurably, again, using MRI studies, between the prefrontal cortex and the amygdala, which are clearly involved in emotion regulation. That's that self-regulation circuit. which are also correlated with reductions in mood disturbance and negative emotions. And then I think pretty excitingly, that just by being in coherent states, they were practicing 10 minutes a day for over a 4-week period, significant reductions in plasma levels of amyloid beta and tau levels, actually, which of course are associated with Alzheimer's and dementia. So just by being practicing coherence. Now, I couldn't put all the references that's on the slide. It just looks too messy. But anybody who's interested in all the references, everything I just shared is referenced in this recent paper we just published in one of the Nature journals, Scientific Reports. This is the title of it, Heart Rate Variability, Biofeedback, and a Global Study of the Most Common Coherence Frequencies. So that paper is freely downloadable from our website, or you can just go to the journal and download it as well. It's an open access paper. So all those references for that and more are in this particular paper. And one of the things I find kind of really neat and exciting to see is when we look over 7 years of the data, this is around 10 million biofeedback sessions, is we see that, at least in this community of quite a few people practicing this around the world, that their coherence is increasing over time if we look at the average level of coherence globally. That's a nice thing to see. Okay, I'm going to shift gears a little bit here and talk about the energetic aspects of the heart. And when we put electrodes on the body, if we put them across the chest to measure the electrocardiogram, or we stick them on the head, the brain to measure on the head to measure the electroencephalogram. Well, those are called cardiogram or encephalogram because we are literally measuring electricity, current flow. So that's what the electrodes see. That's all they see is current flow. But I'm sure you all know that kind of science or physics 101, whenever you have a flow of electrical current, whatever type of current flow that is, you generate a magnetic field. Now, one of the qualities of magnetic fields is they go through things, right? They penetrate. This is why cell phones work indoors. That's the magnetic component that's going through the walls and the windows to carry the information from your phone to the cell tower, your voice, your text message, whatever. The older I get, the more I come to realize that all of our technology, nature beat us to all this, and we work the same way. The electrodes, of course, do not see the magnetic field. You need a different device. That's called a magnetometer. And you can put it, in fact, most larger hospitals have what are called MCG, magnetocardiogram, where you never touch the body. These are sensors around the body, just measuring the field that's radiated externally from the body. Now, you can also do it for the brain, right? MEG in that case. Now, if you can back that magnetic sensor up, you don't typically because you want a high signal noise ratio, but you can back up the magnetometer actually a number of feet from the body. And it's about 3 feet away, and I know American terms here, but before you lose the capacity to detect the cardiac signal, the magnetic field generated by the heart, for the brain, it's about 1 inch away. So it becomes kind of clear that when we're talking energetics on the magnetic field, I'm just going to use the term energetic here because it is an energetic, a moving energetic field, that the heart's the big player. So what we were able to show here in our lab back in the 90s was that when we measure this field externally from the body, we can analyze that field. I used to be a communication engineer from Motorola back in my youth, younger days. Using the same techniques that I did then, we can decode or demodulate, see the information being carried by that field. And for sure, there's no question that the magnetic field of the heart is carrying emotional state information, probably a lot more that we have to still sort out. So you can kind of think of this as your personal field environment. Now, when we look at the information being carried by that field, here's an example, the same person, and 2 different emotional states, appreciation on the left and anger on the right. And you can see that these information patterns, these vibrational information patterns, are being carried by the field of the heart, the magnetic field. And I don't have a lot of time to go into detail here, but the main thing is to understand that they're different. Now, when we're in a coherent state, in fact, if we can look at the heart rhythm and know exactly what the information in the field is now. There's a direct mathematical relationship between the two. When we're in that appreciative, coherent state, like with appreciation or kindness that we go into naturally, it's also a more coherent field in the magnetic field. But the main point here is they're different. And a number of studies have now shown there's a big so what to that. And that is that let's just think of our nervous system also as a big antenna that is specifically tuned to other biologically generated fields. One of my mentors, a guy named Ross 80, was able to show that in terms of external fields affecting biological systems and in humans in particular, that we have windows, very specific windows of the amplitude and frequency of external fields that we have a nonlinear response to. As it turns out, those windows are almost exactly the same windows. They're, in other words, tuned to other biologically generated fields. So the study I'm showing you here was one that was done probably back in the 90s. I'm trying to remember now. Horrible with past dates. But anyway, this study was looked at 40 people that were divided into groups of 4, and they were around a table being monitored. 3 of the 4 were trained 2 weeks before the experiment, and the 4th person in each of the groups was naive to the real purpose of the study. And basically, it was a really well done study, by the way. The 3 people were signaled at random times to shift into coherence in a way that the other person didn't know what was going on. And the primary question was, does it affect the person who doesn't know what's happening? And the answer was yes. They overall, not every case every time, but as the study as a whole, there was a very strong, measurable and significant factor in that person becoming more heart coherent themselves. So this was one of the first studies to demonstrate that when we're more coherent, simply said, that field is interacting with others in a way that helps lift them into a more coherent and balanced state. So what we're feeding the field, so to speak, does matter. It has measurable effects on others. So that study also hinted that there was actually synchronization, a kind of a complex synchronization within that group going on as well. Now, for synchronization to occur, physiological synchronization between people or between people in a group, there has to be some type of a signal that is interconnecting those individuals, and that can be a lot of types. If you're in the same room or like in a conversation with somebody, it can be across visual. Clearly, it can be electromagnetic, as we've shown here in our lab. Sound, you can be tactile. You might be stepping together, walking together, these types of things. It can be chemical, or in later studies, quantum entanglement. But something's conveying that information. And physiological synchronization is really just getting off the ground, but it's quickly becoming a really an important field of study, especially in social sciences, because there's enough studies that show now that when people you can think of getting in sync physiologically with others as the ground state that allows for prosocial behaviors. People hear each other deeper. There's another type of connection. It leads to trust, cooperation, these prosocial behaviors between group members. And we clearly can be emerging now that when people are, if you don't have some type of an emotional connection with people, you don't tend to synchronize. And here's the study we did here in our lab some years ago now with 20 people. In this case, they were in the same room. And there was a number of steps to the protocol. I won't go into all that now, but in one of the parts of the protocol of this experiment, we paired them up, not necessarily physically, but so person A would shift into coherence and actually consciously feel love or appreciation for person B for A, C for D, D for C, so on. So we had them specifically target or focus who they were going to feel positive emotions towards. And in that segment of the experimental protocol, by far was the clearest synchronization between the individuals across the whole group. It was pretty amazing what you see here. So you see the actual heart rhythms that were going on. And on the right is the spectrums, the frequency spectrums. And we see this amazing degree of frequency synchronization occurring between these individual pairs during that phase of the experiment. So that was more of a local, they're in the same room. But a study we just published actually, I think last month, again in Scientific Reports in Nature Journal, took this to another level. It showed this synchronization can happen globally in groups where you have a positive emotional connection. So this, in other words, when you work together with people and you form positive connections, you create a global, a non-local field that is interconnecting group members. Okay, so I just wanted to introduce you quickly to a technique that I wanted to share this one because this is something that's healthcare professionals so you can use right in the moment, maybe when you're seeing a client or interacting with others. It's called shift and lift. And so this is a technique that you could use with eyes open, right in the moment. Nobody needs to know you're doing it. First step is called heart focused breathing. This is where you focus your attention in the area of the heart. Imagine your breath is flowing in and out of your heart or chest area. Breathe a little slower than deeper. Find that rhythm that's comfortable. And then consciously activate feelings of kindness, appreciation, a genuine connection, or an attitude of deep listening. Okay. Wish we had time to practice this, but I know we're almost at the end of our time here. And then radiate those heart qualities or actual frequencies that I've just shown you to raise your own vibration and help lift the energy field environment that surrounds you. Okay, so and this is something you can do in real time. This is real data. We do a lot of ambulatory recording where a person who actually did this, you can kind of see their actual, where they got frustrated, that's in red. Remembered to use the technique, shifted into coherence, and I was able to regain a positive connection. And I've just got one concept left, and I will be done. I'm probably running a little over time here, but pretty close, I think. In the M-Wave Pro, there's also an additional module called the Plus, and this is for HRV assessment. And I wanted to share this with you because this is something you can do in 1 minute. We spent quite a few years looking at short-term versus long-term HRV protocols, and this is the quickest and actually most accurate measurement that you can do to measure how much overall HRV a person has. So to get a sense of where is this particular client or patient in terms of their health status or risk, these types of things. Who's depleted, who's not, because you often can't tell by looking at them. It's called the 1 minute pace deep breathing assessment. And so this particular assessment has the highest correlations of all the short-term protocols that we looked at, resting state and a bunch of other things, to 24-hour measures, which is the gold standard. So done properly, it has about a 0.8 correlation to 24-hour measures. And basically, one of the assessments in the M-Wave Pro Plus is we basically pace their breathing at the resonant frequency and have them breathe as deeply as they comfortably can. So you're challenging the nervous system. You're asking the question, what is the maximum HRV their nervous system can produce, the whole neural axis? And then that gives you an age-adjusted report on where they should be in terms of the various HRV measures. And my last slide. And there are a number of certifications. These are very inexpensive certifications that specifically for healthcare professionals that basically teach you how to teach this to your patients. And so there's anyway a number of places you can go to the heartmath.org website and get access to those. And with that, I'm going to say thank you and wish you all a great day.
Okay, great question. I'm going to try my best to translate it for you, Dr. McCraty. So she's asking how heart coherence could be implemented to treat dissociative disorders and how we can bring people like more in their body to regulate them.
Oh, great question. Um, yeah, it's really what it does. In fact, I just didn't have a lot of time today, but I would say the largest problem facing humanity is disconnection and disassociation.
Mhm.
We're separated from our larger self, which I didn't have time to get into today in a lot of our studies on intuition and from others. In fact, from my perspective, a lot of meditation techniques and relaxation techniques really are dissociative. and we need to go the other way. So all of our techniques are really getting people more into their body and really interconnected, getting in sync and connecting more with with our own larger self or higher self, whatever you kind of want to call it, getting ourselves in sync. So it's why we really focus on, as I started saying, emotions run the show. Um, the breathing at our resonant frequency can help step one, but then we also want to activate feelings of kindness or even breathing a feeling of inner stillness. These things all help reconnect us and get us back into our body and back grounded in sync of who. Um, anyway, I could go on here, but I don't want to take too long. So
Yeah.
that's
Thank you for answering the question. Perfect. So another one? You have another one.
great.
Yeah. Okay. So the electromagnetic, heart coherence with the brain, is it like impacted by fascia being immobilized? Does it make sense?
Yeah, I think so. Yes and no. um, I mean, you can still be coherent, but the fascia actually is. Remember I mentioned earlier there are four ways the heart communicates with the brain and body, and one of the other ways is it's called volume conduction. So there's the magnetic, which doesn't matter. In fact, the magnetic field and current flows within the body affect every cell in the body, and it's a synchronization signal for all the cells. But the fascia is also another one of those current pathways, if you will, throughout the entire body. Um, so, yes, there can be an effect there, but it's not going to stop one from being able to shift into and practice the coherence skills. Really, coherence is really I talked about the heart and brain, but it's really whole body coming into sync, and the fascia does become an important part of that story.